Welcome back. Austin Harper joins us now from Precision Spine Care. Thank you so much for stopping by here today. So today we're talking about those aches and pains during this time of the year. We all know what I'm talking about. When the temperatures go down and the holiday happenings start ramping up, you know, you're just feeling it. You're reaching for the Tylenol, Advil, whatever you can grab. So tell me, what in particular really makes these aches kind of increase during the holiday season?
Sure. So, I mean, of course, during the holiday season, it's a very stressful scenario for anybody. I mean, and then stress can lead to worsening chronic pain. So people that are having to, travel, go shopping, cooking, cleaning around the house, doing these social activities is a very stressful time. And as with your normal everyday life, adding this on top of it just makes everything worse. And then patients with chronic pain, when stress is involved, their chronic pain that is recently managed can become more severe during stress. So as with anyone who gets nervous, we get those tension, we get those aches, and those aches can turn into muscle spasms, and over time those can lead into worsening chronic pain. And actually, the way that stress is interpreted in our body can actually make our pain worse in time too. So what used to be a minor ache, with the body's having stress on top of it, this can be a more significant type of pain that the patient's experiencing. So whenever the stress is involved, what used to be a normally managed chronic pain can be very severe during this holiday season.
I mean, I feel that. I feel like I put all the Christmas decorations up and I'm just paying the price on my back.
Exactly,
I mean, it's just crazy. I mean, I did it all by myself, so humble brag there. But does the weather have anything to play with it? Kind of getting cooler?
Does, yeah. So we've seen, and there's been research that's shown that weather does help or make pain worse. There's lots of different reasons behind this. One of the reasons is actually the pressure changes that are seen with the cold fronts coming in and the weather coming in. You've seen people that say, I can feel my aches and pains are hurting, so I know it's going to rain. And there is actually some truth to that. So the pressure that happens and it lessens, the barometric pressure can actually allow for joints to inflame and expand and become more painful over that time. And then people that are don't want to be out in the cold weather. They want to be inside. They want to drink the hot cocoa, be by the fireplace. And that actually can worsen people with joint pain, because you can think of it like the fluid in the joints is like motor oil. It can thicken without activity or during the cold weather. So if you're not moving and you're not being more active, they can actually thicken around those areas and cause more pain.
Yeah, it's so true. I mean, I feel like you want to be more active in the summer. You want to be outside more. So the big question we have for you then is, what can we do to get this chronic pain to go away, right?
Right, yeah. That's what everyone wants to know. So one of the key things, especially what we discussed, is being more active. Even during this holiday season, which it may be a little bit harder to do when it's cold outside, but doing some walking, some light exercise, get those joints moving. And then no one wants to hear this, but you have to watch what you eat. So
I didn't hear you.
Yeah,
what was that
one? Some meals can actually lead to more inflammation in the body. So limit the red meats, the processed starches, the sugars, unfortunately, the fried foods. Those things can all lead to inflammation. And then last but not least is that people with chronic pain need to put a hard stop to some of their activities during this time. So everyone gets caught up in the activities. There's things always that are happening around the corner. And people with chronic pain, whenever they push themselves too far, they're paying for it for several days afterwards. So if you're doing activities around the house, do them for 15 to 20 minutes and then rest for a few minutes and then continue doing the activity afterwards. Or if you're going out for a social event, before you even leave the house, make sure I set a hard time for myself to come back home so that I'm not paying with this pain for several days after.
Then your pet's for. You have to go let the dog out, and then you get to go home, right?
I gotta go, relieve the babysitter type thing. Exactly.
Austin, thank you so much for stopping by.
Sure.
Well, we'll be right back.